So today we will discuss about the coronal section of this kidney. First of all, we can see that kidney is covered by renal fibrous capsule. Here we can see renal fibrous capsule. This is also called true capsule. The kidney is covered simultaneously by 4 layers. The innermost layer is renal capsule, then the outer one is perirenal fat, then the third one is renal fascia, which is also known as false capsule, then comes the outermost pararenal fat. Now here we can see a slit-like space, a projection which is called the hilum of this kidney. Through this hilum, many structures comes in and out from the kidney. There is a sequence from before backward. The structures passing in and out from the kidney are renal vein, then comes renal artery, then renal pelvis. This is renal pelvis. Now here we can see granulated pale portion. This granulated pale portion is called cortex, and this dark striated tissues, this portion are called medulla. This medulla is, here we can see properly that it's pyramidal in shape, so we call it renal pyramid. Now here we can see the inward extensions of the cortical tissues. Inward extension of the cortical tissues. These are called renal columns. Now the apical portion of all the renal pyramids, this is the apical portion, here is the apical portion, this is called renal papilla. This renal papilla, through this renal papilla, the actual filtrated urine empties into little tube-like structures. These are called minor calyx. This is a minor calyx. This is a minor calyx. Few of the minor calyx combines and forms major calyx. Now this major calyx together combines and forms renal pelvis. That is the renal pelvis. The renal pelvis comes out from the kidney in the name of ureter. This is the ureter. Now we will discuss about the blood flow of the kidney. So as we know, in this portion there goes abdominal aorta. There goes the abdominal aorta. And the renal artery is the branch of abdominal aorta. So blood first comes from the abdominal aorta through this renal artery. Then it divides into anterior and posterior trunks. See, here we can see the anterior trunks and there is the posterior trunks. So here anterior and posterior trunks. Then it divides into segmental artery. Segmental artery. Then it divides into lobar artery. This is the lobar artery. That one. Then interlobar artery. Between this both lobe, this is interlobar artery. This is interlobar artery between two lobes. Okay. Now at the basal portion of the pyramid, here we can see the interlobar artery arches. Here it's arches. So this is called arcuate artery. Then it goes in the cortex between the lobules and it forms interlobular artery. Interlobular artery. Then it goes here as afferent artery, afferent arteriole. Then it enters into the glomerulus. Then it comes out as efferent arteriole. Then it forms peritubular artery. Then this is the interlobular vein. Interlobular vein. Blood passes through the interlobular vein and comes in the arcuate vein. This is a vein making arch through the base of the pyramid. This is arcuate vein. Then it comes interlobar vein. This is interlobar vein between two lobes. Then it comes as lobar vein. This is lobar vein. Then it comes drain into the renal vein. This is the renal vein. This is renal vein.